Perfect. Thanks very much, Dave. Okay, so first of all, I want to talk about what metabolic health is first. So in my opinion, metabolic health is when your body doesn't function properly. It's not running optimally. And then over time, it's going to lead to chronic disease. Chronic diseases such as type 2, obesity, dementia, mental health, the list goes on and on and on. Heart disease, obesity, things like that. And I believe that most people we're all focusing on the wrong problem. A lot of people want to become insulin sensitive. They think the best way to do this is through exercise. And a lot of people think that they're eating properly. But the problem is a lot of people are still struggling. So the question is this, like, where are we going wrong? And this is where a lot of people at the moment are relying on medication. A lot of people are relying on medication. You only have to look around now. A lot of people are focusing on these weight loss injections. So this is where we need to be focusing on more of our health instead of just focusing on how we actually look, because that's the problem at the moment. You can look amazing, but if you've developed pre-diabetes along the way, it means absolutely nothing. If you're in severe pain, joint pain, back pain, it's affecting your mental health, all these health issues along the way, this is what we should be focusing on. This should be the goal. This is what I struggled with for a long, long time. I've been in this industry now for well over 25 years. I used to coach this way to people. And I used to get questions like, Mark, I'm still in pain. I'm still struggling with my food. I have these regular cravings. How come I can't sustain my weight loss? Why do I have to binge at the weekends? All these things that I used to get told in the past, and I didn't know how to answer them. And it was the same with me. I used to be able to lose the weight, and then I would easily regain the weight. I could go on a low-calorie diet, and I would really, really struggle. And it wasn't until I came across carnivore 4 years ago, and I learned an awful lot about metabolic health. Now I understand what sugar addiction was. Now I understand what food addiction is. And this is what I'm trying to educate people now on a daily basis. We should be focusing on the root of the problem. So where does that root of the problem come from? It comes from an excess of sugar. Now, people need to understand this, that when we look at sugar, we're not just talking about processed sugar, like normal sugar that you put in a cup of tea. No, we're talking about everything, guys, like carbohydrates, processed food, fruits. Like, these are all going to impact the body the exact same way. Now, what happens when you put too much sugar into the body? It leads to inflammation. It leads to chronic inflammation. This is where we're all suffering at the moment. The key is we need to remove the inflammation. How do we do this? Very, very simple. We keep our insulin levels low. We keep our leptin levels high. So what we need to be focusing on is a rich protein and fat diet. And that's coming from the carnivore diet. If there's any vegetables in there, that's fine. If you have no gut issues, then by all means you keep them in. But if you guys are on a carnivore diet and you're eating your vegetables and you're still having issues like autoimmune issues, IBS, you just feel that something's not right. Your energy is not good. You just feel crap on a daily basis. Well, this could be the last part that you need to remove, which is the vegetables. So it's very, very important that we optimize our health. It's very, very important that we look at hormones and not just calories. The body has no idea what a calorie is. Your body's not run off calories. Your body's run off hormones. There's many, many factors what we need to be focusing on. I've just mentioned insulin. I've mentioned leptin. But cortisol is another big factor. People don't understand that, yes, stress in your life is absolutely fine. But when it becomes chronic, there's the problem right there. And if we go back to what people are doing at the moment, people are exercising every single day. They're doing too much cardio. And this is going to affect stress. This is going to affect your sleep. This is going to affect your eating habits. And you're not going to feel good at all doing it. And plus, if you're doing cardio every single day and you're on a restriction diet, guys, you're going to be miserable. It's only a matter of time before you're going to give up. You're going to quit. Yeah, so basically, when we look at cortisol, we know cortisol, stress is good, but too much stress, it causes a problem. And this is what people are actually focusing on. They're doing too much exercise. It's going to impact their hunger. It's going to impact their sleep. It's going to impact their digestion. And this is where people are really, really struggling. So if there's too much stress on the body, this is going to lead to a sugar or an insulin spike, a sugar spike. a glucose spike, and this is where people struggle with their hunger. So it's very, very important that we look at this as a lifestyle, this whole process as a lifestyle, and not just a quick fix. I think that's the most important thing. I think we need to move away from the diet culture. The diet culture is actually ruining people, because this is where I see a lot of people struggling at the moment. And at the end of the day, if calories worked, we wouldn't be in a national health crisis at the moment with Ozempic, plain and simple. So yeah, that's what I'm coach. That's what I'm doing at the moment. That's why a lot of people, when they come to me, I get the same question all the time. Mark, I've done the diets. I've done it all. I've done the training. I don't know what's going on. I've been to the doctor. The doctor wants me to lose weight, but I'm struggling to lose weight. I don't know how to lose weight. Can you help me? And it's easily fixed. Easily fixed. Most people don't want to do it because they have that sugar addiction. So it's really hard. So it's like talking to an alcoholic and saying to an alcoholic, okay, listen, you're going to stop drinking from now on. It's not possible. That's why I love working with people for 6 months over to a year, because you have to build them into it nice and slowly. So yeah, that's pretty much where I'm focusing on at the moment. I'm focusing more on the health aspect. I couldn't care less how much weight you lose. I'm only interested in getting you healthy first. When you get healthy, it's going to have what you see on the outside is not a true reflection on what you see on the inside. And I always focus on what you see on the inside, because at the end of the day, you cannot see visceral fats. You can see on the outside, but you can't see visceral fat. And this is what we should be focusing on: visceral fat around your organs, being healthy. The key to longevity is just doing the things that's going to keep you happy, giving your body the right nutrition, exercising a few times a week, not running yourself into the ground. Running yourself into the ground is actually going to do a lot more damage going forward. So I don't know if you want to ask me any questions there, Dave, but that's pretty much the bolts of it.